We're expecting very shortly to see some doctors walking out of the Manchester Royal Infirmary behind us, and some of their colleagues who haven't been on shift overnight to join them in solidarity as well. And we are expecting a big turnout here in Manchester, particularly from this hospital trust, a huge hospital in the city centre of Manchester. But of course, as you mentioned, this will be happening right across the country, and a strike which the NHS really has never seen before in its 75 years of existence, something that has just never come across this organisation ever before. 4 days worth of strike, and the disruption is expected to be monumental. Around 350,000 appointments expected to be cancelled, including operations as well. So the strike starting at 7 o'clock this morning, they'll run through till 7 a.m. on Saturday morning as well. And as you've been mentioning, Kay, this is about two things that the doctors say. Firstly, they talk about pay, which they basically say the pay rise that's been offered by the government isn't enough, and they are demanding more for that to be in line with inflation. The union voted overwhelmingly for these strikes as well as a result of that pay offer that was produced by the government. But also, the second thing that doctors say is for the last 15 years, patient care has been on the down. And so what they believe is that with increased pay, with better working conditions, that patient care within the National Health Service can be a lot better. But look, the disruption will be widespread. NHS bosses have said that over the next 4 days, the health service could be on a knife edge, and there will be people up and down the country, those who will need operations, who've had them booked in for some time, those who will need the services of junior doctors across the country, that will suffer as a result. Of course, the next 4 days will be interesting to see how the National Health Service plays out, and whether actually it will come to a point where some of these junior doctors who will be striking this morning will have to go back in to work.